Salam Sejahtera to Puan and all my colleagues. We are from Group 2 and today we are going to discuss about a very important topic that has been rising, especially in the new era, which is caffeine use disorder. And this slide is prepared by us, Meghala Paramasevam, Wannor Akma, Indra Devi, Wannor Shara and myself, Vinotini Kalimoto. Now I will explain the objective of our learning for today. At the end of our presentation, all of us should able to define what is a caffeine use disorder, able to understand on the global prevalence, able to explain on the clinical manifestation, able to explain the complication of caffeine uses. Later on, we will discuss about nursing care plan and health education on how to prevent caffeine use disorder. Now, I will explain to you about the introduction of caffeine use disorder. What you all understand from caffeine use disorder? I believe most of us consume coffee or tea or any other caffeine products on daily basis, right? Caffeine use disorder will become very dangerous when someone becomes very dependent on coffee because it will cause a lot of problems or pain. Actually, caffeine use disorder has not been listed as mental health illness in the Diagnostic and Statistic Manual of Mental Disorder 5th edition as per Bowin 2016. People with caffeine use disorder, they need more caffeine to get same effects every day. And if they cut on their coffee or any other caffeine product, they will experience a withdrawal sign. Have you ever heard of your colleagues saying that I didn't take my coffee today, I feel a headache today? So these are some of the withdrawal signs, and this is very common in people, especially workers who are doing a double shift like late shift, night shift. They will take coffee on regular basis. Okay. As per Butney, Lee and Giuliano 2015, people who use caffeine in a way that make things worse or cause a lot of pain, they will have the disease. They will experience the caffeine use disorder. There are big differences in the number of people with the caffeine use problem around the world and in different places. Actually, these differences is influenced by food, cultural norms of certain people, and how simple it is for them to get a product that contain caffeine. Right now, most diagnostic standards like the DSM-5 that I explained earlier, they don't list caffeine consumption problem as a separate clinical diagnosis. There have been some studies that shows that different countries suggest between 1 and 2% of the people they may be dependent on caffeine. For an example, people who are Scandinavian, people from Turkey and UK, they really consume caffeine in the form of coffee and tea on a large basis, daily basis, and frequently. The number of people who also have problem with coffee may be different in different part of the country. This is influenced with what they eat, how much they consume, and from their cultural aspects. So as a Malaysian, we Malaysian, you can also see that most of us every day we are consuming tea and coffee on daily basis. Best example that I can give you, whenever you are going to a warung or to a restaurant like Mama restaurant, you can see that how many of us are really ordering tea and coffee, and this will really influence the caffeine use within us. As per Cohort 2020, this researcher concluded that younger people, like students and young workers, tend to drink too much of coffee because it is their easiest option and it's very easy to get. As I said earlier, that you can really have access to caffeine everywhere, even a roadside stall, you can get it. And it can be one of the reason why more and more people abuse caffeine. And you can really see, like, I've seen most of my colleagues who are working night shift with me, they are really consuming 2 to 3 coffees in one night just to prevent them from sleeping, and it will become a habit for them. Like, you can see every day they are consuming this, and it is also a form of caffeine abuse. And there is a chance that many people, they don't even say it and they don't even talk about it, and they don't even know that they are consuming this much of coffee because it is so widespread in the new generation. Almost every one of us are taking this coffee, tea, or other caffeine substance. And you can also find some sort of caffeine in the canned drinks. Yes, it can be also available on the supermarket, and people who doesn't know the abuse, yes, they will consume it on a large basis. Not many people are aware of what they are consuming these days.
Good day, everyone. So now we're going to see about clinical manifestation from caffeine use disorders. When someone abruptly quit drinking coffee, they will become more irritated, drowsy, depressed, and unable to concentrate. Helplessness to fulfill important responsibilities at home, in the classroom, or at work. Addicted to coffee have problems with interpersonal relationship and social interaction, or experience these problems first time. Reduction or elimination of involvement in activities that are important in social, professional, or recreational environments. We will discuss about the complication of caffeine use disorder. Caffeine use disorders may lead to high blood pressure, high heart rate, ulcers in the gut tract, trouble sleeping, mood swings, become more anxious, and they will also have social relationship as irritability or anxious. Thank you.
Hello everyone, my name is Wanya Shara. I will continue to explain the slides on treatment. The first one, caffeine addiction tends to be minor, which is actually we don't really have to treat them. People tend to get over it easily and may include therapy focusing on providing educations about the effects of caffeine. So, what I'm trying to say is we can treat all this caffeine disorder just by a regular therapy, which we have to focus on the side effects or the bad effects of caffeine. And then some may also benefit from healthy lifestyle changes like limiting caffeine use and promoting proper sleep habits, because as all we know, caffeines will alter or disturb our sleeping patterns. So if we emphasize them and give proper educations on the bad effects of caffeines, most of them will try to get over it by themselves. Next, we often just share tips for breaking caffeine addictions, such as recognize how caffeine affects us, because every people has different effects on caffeine. Some would have sleeping difficulties when they took caffeine, but some just can sleep well even though they took lots of caffeines. Assess your daily caffeine intakes. Set realistic goals when cutting back. Just in case, like this patient took 5 packets of caffeine every day, so you cannot just cut off all 5 caffeine in one day. You just have to cut down it slowly, because if you cut down abruptly, it will cause more addiction to the patient. Next, lower your caffeine intake gradually. Like I said before, prepare your caffeine withdrawal. You have to set your mindset. Make sure you are ready to break your caffeine addictions. Next, ask for support from loved ones. This is very important because if you do by yourself, you tend to stop in the middle and get uh, disappointed, or you have low moral support. Next, be patient with yourself. You cannot break it in one day, so it happens gradually. Next is medications. Actually, there is no exact medication for caffeine withdrawals, but medication can use to alleviate the unpleasant symptoms of caffeine addiction or withdrawal, such as headache. Some of the patient, if they took caffeine, they tend to have severe headache and lack of sleep. So by reducing all these simple things will make it easier for you to break the caffeine addictions. Next, there are over-the-counter pain relievers such as Tylenol or aspirin, which one can use to treat caffeine-induced headache. Okay, some patients also, if they don't take caffeines, they can have a severe headache or have a severe symptoms. So they took caffeine to uh, get over the headache and all. So it depends on the patients actually. That's all from me. I'll pass to my other colleagues. Thank you.
Hi, salam sejahtera. My name is Wan Nur Akma. I will continue my part. It's nursing care plan. So, case scenario: the 35 years old interior designer Mr. M consulted doctor in the hospital due to severe palpitation, unable to sleep, and anxious. During history taking, noted Mr. M taking 5 cups of strong coffee, contain high caffeine coffee as his energy drink from morning till late night. So, nursing care plan for Mr. M's caffeine use disorder should focus on his pattern of caffeine use as well as the anxiety and sleep issue that come along with it. Okay, nursing care plan number one, diagnosis sleep impairment related to excessive caffeine consumption. So, nursing goal, Mr. M will be able to have a good sleep by reducing the coffee intake. Nursing intervention and rationale, advise Mr. M to reduce his intake from 5 cup to 2 cup per day. This is to prevent sleep disturbance. Advise Mr. M to follow the regular wake up and sleep time. This to promote a good sleep. Advise Mr. M to prevent taking caffeine 6 hours before sleep. This to prevent sleep interruption. And advise Mr. M to keep track how much caffeine he has been consuming. This to ensure he never take over limit. So evaluate Mr. M's progress of caffeine reduction, improvement of sleep pattern. Okay, nursing care plan number 2, the diagnosis, anxiety related to caffeine induced symptoms. So nursing goal, the anxiety that Mr. M feels as a result of caffeine withdrawal will subside. So nursing intervention and rationale. Number 1, advise Mr. M to be relaxed by teaching deep breathing exercise and muscle relaxation exercise. This is to reduce his anxiety level. And second, ensure Mr. M does his routine relaxation as scheduled. This is to see the progress of anxiety being reduced. Number third, ensure Mr. M aware of on the regular physical exercise. This will help the stress level be better. And number four, ensure advice taken from some counselor or some mental health expert on how to manage Mr. M's will enhance the better treatment option. So the evaluation is assess change in Mr. M's anxiety level and his ability to manage symptoms. Okay, we continue nursing care plan number 3. Nursing diagnosis, knowledge deficit related to the health risk associated with high caffeine consumption. So nursing goal, Mr. M aware on the complication of taking higher caffeine by educating Mr. M's. So nursing intervention and rationale, make sure Mr. M understand that a lot of food contain caffeine. This is to ensure he does not take those, such as chocolate, or if he drink tea also is contain caffeine. And discuss with Mr. M that drinking too much coffee will create a lot of side effect, and notify those effects, such as like he can feel nervous or palpitation. Sometimes his body feel irritable. So this will ensure he knows the complication and avoid them. The last, ensure give Mr. M the material and internet sources for caffeine education. This will allow him to explore and gain information required. Like now, we have a lot of sources, like especially now in TikTok, they share a lot of advice or education. Sometimes you can see from TikTok. So the last evaluation, evaluate Mr. M comprehension of caffeine related health risks and his ability to make informed choices.
Hi, my name is Megala. I will continue with the next slide on health education. Give awareness talk about the chances of having more anxiety, trouble, sleeping, irritability, and mood swing. Suggest slowly cutting back on coffee to make a withdrawal effect less or replace it with a green teas or sugar-free drinks. A good habit to get into asking them to keep a journal about how much coffee they drink is written by Pardo Lozanlo and the team in 2017. Teach them to spot the sign of withdrawal such as headache, tired, getting impatient, and having troublesome in focusing. To help them deal with the withdrawal effects, remind them to drink a lot of water, try to take a light painkiller if really needed, and try to get enough sleep. Teachers should teach their students other devotional therapies such as yoga, meditation, deep breathing exercises is a way to relieve stress without over-consume a coffee. It's written by Richard and the team in 2022. To seek a doctor's advice for those are having a hard time to giving up a coffee. Educate everyone by poster exhibition, advertisement of side effect of overconsume of caffeine intake, especially in school, college, workplaces, and community health programs. Different people with a caffeine use problem need a different kind of health education. It's based on their drinking habits, health, and the way of life. As a conclusion, I would say a high consumption of caffeine may not be healthy for our life. Increased intolerance, anger, anxiety, antisocial disappear, and disruption in daily tasks are signs and symptoms of high caffeine use disorder. In order to promote healthy lifestyle choices, educate the public of side effect of caffeine, distinguish between healthy and disordered usage, identify withdrawal symptoms, and more. Thank you.